It's a beautiful day. Lucky that we live Hawaii.
24/7, 365.
Swimming in the ocean anytime.
Take a leap.
Live healthy. Eat well. A, be active. P, live mono every day.
East side, take a little bike ride. West side.
Aloha kako, and welcome to our 6th episode of Foundations for Healthier Generations. I'm your host, Lorilyn Salamanca, of the WIC program at the Department of Health. It's nice to be with you once again to highlight our state health department's public health programs, initiatives, issues, and public health concerns. During our last episode, we interviewed Neighbor Island Department of Health employees who are involved in promoting and supporting breastfeeding. Well, today I'm pleased to welcome Andrea Beckland, Program Manager for the Public Health Preparedness Program.
Thank you, Laura Lynn. I'm very happy to be here today.
Well, it's a pleasure to have you, Andrea. And Andrea is here today to address one of the foundations that's part of the department's strategic plan, which is emergency preparedness. So if you could tell us a little bit about the background, about the purpose and the mission of the program.
Sure, Laura Lynn, I'd be happy to do that. Thanks for this opportunity to share about the Public Health Preparedness Program at the Department of Health. The program is really an integral part of the department's commitment to prepare for, respond to, and assist in the recovery from natural or human threats that impact the community's health and well-being. Just to give you a little bit of background information about the program, it actually has been in place here in Hawaii for quite some time. It was established in the late 1990s. Through funding a cooperative agreement with the Centers for Disease Control and Prevention, which are based in Atlanta, Georgia. In the very beginning, the program was fairly small in scope, and a lot of the funding was used to, first of all, build up the emergency response capacity at our state lab to be able to test and detect chemical and biological agents that could pose a threat to the public's health. There's also a lot of funding that was utilized towards building up our epidemiology and disease surveillance capacity within the department. Once again, looking at potential public health threats that we might need to respond to. Initially, the focus of the program was a lot on bioterrorism. That was because of the events of September 11th and the terrorist attacks on the World Trade Center, and then the subsequent anthrax attacks that took place afterwards. So during that time, there was a lot more attention that was paid towards health departments having the capabilities in place to respond to those worst case scenarios. So looking at bioterrorism, anthrax, smallpox incidents. Over time, and especially over the last few years, the program has grown in scope again considerably. And so the focus is not so much on bioterrorism anymore, although that is still recognized as a threat. But really the program has taken on much more of what we call in the emergency management community an all hazards approach. So looking at what are the most relevant risks that the health department may have to deal with here in Hawaii, and developing response plans in order to try to mitigate those risks as much as possible. So we look at a whole range of different types of scenarios, from pandemics and other infectious diseases to we still look at chemical and biological terrorism as a possibility. But also looking at environmental issues and radiological incidents that could take place, as well as just looking at some of the long-term impacts of things like climate change and the role that plays in disasters. And then what's so relevant here in Hawaii is the risks for different types of natural disasters. So we have to plan accordingly for disasters such as tsunamis, hurricanes, to things like flooding. So we've really had to broaden our scope over the years and increase our response planning accordingly.
And that is a lot to prepare for.
In a way, yes. You've hit the nail right on the head. If you think about any major, incident, whether it be a hurricane, tsunami, disease, there's always going to be a public health impact. Just to give you, a recent example, looking at what happened on the East Coast with Hurricane Sandy, and the aftermath, and the cleanup and the recovery efforts. I mean, of course, there's going to be a public health response. Just think about what some of the concerns might be. With the power outages and lack of electricity for days at a time. There's always issues with people maybe eating contaminated food. There's clean water access. That could be an issue. Sanitation. Access to health care. In these situations, sometimes hospitals are completely closed down because they're impacted, or they have to be evacuated to another location. Looking at special needs populations and whether their needs are being met. And also just psychological impact that some of these major events might have on communities. So definitely, no matter what the situation is, typically there's always a public health response. And really over the years, the public health community has learned a lot from some of these major events. You just look at the past 10 years and some of the major emergency situations that have taken place. There's been Hurricane Katrina down in New Orleans. There was the tsunami in Southeast Asia, affecting many countries. Just a couple years ago, there was a big earthquake in Haiti. And then, what's really recent in all of our memories is the earthquake and tsunami in Japan. So, I think that, we've been able to learn a lot of lessons, through, some of the mistakes that have been made in these past responses, and we've been able to, build those into our response plans.
Yeah, and some of those public health impacts that you mentioned aren't always, I think, shown in the media. What's typically shown are the immediate impacts, the devastation, but those public health impacts sometimes can't translate into visuals. And I think some folks forget that those are things that we have to prepare for. And so what are some, I guess, practical and realistic reasons or ways that the public can prepare?
Well, thank you for asking that. That's a really important question. We can't really pinpoint when the next disaster might strike. And, just looking at, recent events here in Hawaii with the, tsunami warning that came up, quite unexpectedly, and emergency management and the public was tasked with quickly responding to that situation and evacuating people from the coastline pretty rapidly. So these things can happen very quickly. So it's good if you take your own personal preparedness into account as much as possible. And there are some basic things that we all can do to better prepare for an emergency situation. And you and your audience, you might be already familiar with some of these steps, but I'll just go over them really briefly. First of all, it's really important to make an emergency kit. Something that you have on hand that you can, take with you quickly when you need it. It can be kept, in your workplace, in your car, in your home. And it should just have, basic supplies that can sustain you, for up to a week, even longer, if needed. And we'll go over what's contained in the kit in a minute. But another step is just to stay informed, through whatever medium you can. If there's internet access, staying tuned that way, or looking at social media sites. It's a good way to exchange a lot of information. Television, is also a useful source, as well as the radio. That's why it's so important to include a radio with batteries in your emergency kit, so you can stay tuned. The Department of Emergency Management also has a service here in Hawaii. It's a Nextel service, it's called, and if you're signed up, you can receive text messages that will, provide you with updates on the situation as it's occurring, and also provide you with directives on things you should do. So that's a very good source of information as well. The last step is just to have a plan in place, and rehearse that plan, with your family or friends. And that plan should include, just having the appropriate contact information, having sort of a designated location, where you can meet with your family in case you're separated. And just in a plan for if you have to shelter in place and stay at home. So recently, during National Preparedness Month, that was in September, some of our program team from the department ventured into downtown Honolulu, and they wanted to see whether folks had taken any of these steps, sort of do an on-the-spot quiz. So we filmed some of these person-on-the-street interviews, and we'd like to share that with you today.
Oh, yeah, great. Well, let's go ahead and see it.
Aloha! September is National Preparedness Month. The Hawaii Department of Health's Preparedness Program wanted to help spread the word and promote more awareness out there in the community.
So we headed downtown Honolulu and did some quick on-the-street interviews of passersby. This video shows some of the great responses we got.
Interviewees were rewarded with a fabulous Department of Health Emergency Go Kit bag to help them on their way to being prepared for emergencies or disasters.
Here we go. Let's go downtown. Did you know that September is National Preparedness Month?
No, I didn't know actually.
Oh, no, I didn't.
No.
Do you have a preparedness kit ready?
No, I do not.
Okay.
A partial kit at home.
I don't.
Can you name at least 3 items that you think should be included in that kit?
Yeah, sure. Okay, so 1 bottle of water.
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 Bowl of water, perhaps? I would definitely put a lot of water.
Water. Bottles of water. You need a supply of water.
Food. Canned foods.
Canned
foods. Crackers or something to eat.
Cracker.
That's it.
A piece of bread, I don't know.
Food.
Some easy starchy, high carbohydrate food. I have a lot of rice and soy milk in my room.
Canned goods.
Food.
Canned goods.
Canned goods.
Food. Food just in case.
Radio.
Okay.
Radio. Emergency communications, like a walkie-talkie of some sort.
Medication.
Medications.
A blanket or something like that.
Extra clothes.
I'm thinking anything that you need for the next 72 hours, like maybe change of clothes, a blanket.
Flashlights and battery.
Flashlight.
Flashlight.
Like a flashlight?
Flashlight with extra batteries.
Flashlight.
Flashlight. Band-Aid, perhaps?
Band-Aids.
We have a kind of a first aid box in our garage, so if anything kind of medical happens, then we have all the supplies in there.
So there you have it, some of the essential supplies everyone should have in case of emergency or disaster.
Are you ready? Get your emergency supply kit and be prepared all year round. For more information on preparedness steps like making a plan, creating your supply kit, go to any of the following websites.
Mahalo and aloha.
Well, that had a couple of things. I mean, from that list of items that needs to be in your emergency preparedness kit, there are a couple of items that I don't have and didn't really think about, like the hygiene items, I think, and the can opener. I have canned goods, but no can opener. So I have to go back home and do that. And I think here on the table we've got some examples of what can be part of one's emergency preparedness kit at home. Yeah. Anything special? I think from this kit that I see the gloves. That's something that I haven't thought of as well.
I guess one important thing to highlight is if you're taking any medications or if you have, any kind of medical supplies that you need to make sure that you take that with you. That's really critical.
Right. There are certain things that we do take for granted, like access to the pharmacy, access to the doctor, medical care. So in times of the aftermath of a disaster, we probably wouldn't have access to that. So very good tip with that. Now, typically with emergency preparedness, I think we hear more about state civil defense, the police and fire department, agencies like that. So how does your program work with those agencies?
Well, collaborating with state, county, and federal emergency management is critical to all of our work, from planning to operations to evaluation and improvement. We work with many partners, as do, most health departments across the nation. State and county civil defense, of course, they're critical stakeholders, as well as non-governmental organizations like the American Red Cross, Healthcare Association of Hawaii, and a lot of other community-based groups. A good example of collaboration that's taking place with these partners is through a lot of the training and exercises that we either lead or participate in. Just to give you an example of a recent exercise that we've engaged in with a partner, during the RIMPAC exercises that were held this past August. And RIMPAC, for those of the audience who are not aware, is one of the biggest naval maritime exercises that the United States is involved in. And actually, it's a month-long exercise that involves, many different countries. And we were actually invited by the Healthcare Association of Hawaii to participate as observers in this large-scale exercise. And so we actually deployed a public health assessment team to identify and test some of the key concepts for these, what we call them public health assessment and surveillance teams. And these are teams that the department is developing that would be deployed in an emergency recovery type of scenario that represent different disciplines across the department, from environmental to public health nursing to behavioral health. The goal of these teams being to go out into communities, into shelters, into healthcare facilities to assess the public health impact, observe any gaps, and then feed that information back to our department so that we can better identify what the gaps are, as well as mobilize our own resources more effectively to respond to the situation. So this exercise was really a fantastic opportunity, and our participation was largely made possible through our partnership with Healthcare Association of Hawaii. There are many other trainings and exercises that we regularly participate in throughout the year. We always work with state civil defense during Makani Pahili, the annual hurricane preparedness exercise, and we try to engage in that process. Also, we have program activities through our district health offices on the neighbor islands. So they regularly work with the county partners to conduct exercises. Just over the last couple of years, we've done exercises focusing on pandemic, on bioterrorism. We did an exercise related to dealing with a SARS type of situation. So really, the scenarios will vary, but we also always try to conduct internal trainings for our employees, to better equip them to be able to deal with different types of emergencies. And on an annual basis, we regularly exercise our own Department Operations Center, which is, sort of the command and control center that does the decision making during an emergency.
Well, there's just so much, I think, that we can talk about in terms of emergency preparedness and public health. We are on a limited time, so I just wanted to ask any final comments for the public and the audience.
Sure. I'm very happy that I've been able to share this information with you all today, and hopefully it's been useful. For more information about our program and just to learn about public health emergency preparedness, please go to our website at prepare.hawaii.gov. We also are on Facebook, so you can access that as well. And I guess I'd just like to leave you all with one last preparedness reminder, and that's to have a plan in place.
Yeah, definitely. And I think we have a video that we would like to share as well. And I believe it's about having a plan. Yeah.
Yes.
So let's go to that.
Aloha! It's National Preparedness Month, and the Hawaii Department of Health's Preparedness Program has joined others across the country to encourage people to get ready and be prepared for emergencies all year round.
Staying informed and making an emergency supply kit are two important steps. Another thing everyone can do is make an emergency plan, so they'll know what to do if disaster strikes.
It's easy to talk about it, but are people really planning ahead?
Let's see what some of our community friends and neighbors have to say.
In an emergency, do you have a plan ready? Do you have an emergency plan, like who to call, where to go?
No, my family, we don't have a written plan or anything like that.
No, not currently.
No.
No. You don't?
Not a formal one.
I have an emergency plan for both me and my 2 cats.
No, not at all.
Okay.
Just run, I don't know.
I think that you have everything figured out, but I don't have any emergency like numbers that you can call or anywhere to go. Yes.
Okay. Yes, we do. My family owns a care home, so we have backup stuff and emergency stuff.
I do try to keep my possessions to a minimum, so I try to keep things within like a suitcase full, and then I keep my emergency documents in like a folder. So just in case if a disaster was to strike, I would just grab all my things and just hop in my car and go to the nearest safe place.
Yes, we do, and like we just go, at least like now that it's September, we do go over it and it's like what we're gonna do when time comes should something happen.
In a disaster, you may be separated from family and loved ones.
Do you know how you will contact each other? Do you have a plan of where to go or gather?
Many free materials and resources are available to help you get started on making a plan.
So remember, make a kit, stay informed, and have a plan.
Here are some places to find out more information.
Mahalo and aloha.
Hawaii, get ready!
Well, thank you everyone for joining us for another episode of Foundations for Healthy Generations. We'll see you again next time. Ahui ho! Someone had asked.
Gotta get up. It's a beautiful day. Lucky that we live Hawaii. 24/7, 365. Swimming in the ocean anytime.